Hi, my name is Sylvia Costa, and today I will be recording my Foley catheter insertion. As a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that may compromise the integrity of the skills I will be recording today. So what I will do is I will go ahead and start by knocking on the door, coming in, introducing myself to the patient. Before I come in the room, I want to perform hand hygiene, and I want to talk to my patient now. Hi, Ms. Smith. My name is Sylvia, and I'm going to be your nurse today. I'm going to be inserting a Foley catheter today. Did the doctor talk to you about it? Yeah? Okay. Can you verify your name and date of birth for me? Perfect, Ms. Smith. And can you tell me, are you allergic to any latex or any iodine? No? Okay, perfect. I will perform, close the curtain to perform privacy for my patient. What I want to do is I want to explain the process to my patient. So Ms. Smith, what I will be doing today is I'm going to insert a catheter. I obtained the orders from the provider. I checked the EMR, checked your allergies. Now, can you tell me, have you ever had this done before? No? Okay, so what it is basically a just plastic tube that is going to go in through your meatus, and then it's going to go up to your bladder, and it's going to help empty your bladder. Okay, what I want to do is I want to also check the medical record for any pathological conditions that may interfere with the insertion of the catheter. Now, what I will do is I will go ahead and raise the bed up to a working height. For this purpose today, though, I will not do it all the way, just so you guys can see my field. I will start by examining my patient. So, Ms. Smith, I'm gonna lower your blankets down and I'm gonna start working. What I'm gonna do is I'm going to uncover your, put your blanket down, and I will be uncovering your hips and your vaginal area, if that's okay. Yeah, okay. What I will do right now is I'm going to put on my gloves. I want to have my patient assist me in putting a waterproof pad underneath, so I will instruct my patient to help me by lifting up her hips. I will place the pad underneath, and I will ask my patient to raise up her knees, open up her hips, also relax, so that I have space to work and insert the catheter. What I will start by doing is I will start by palpating. Okay, Ms. Smith, I'm gonna go ahead and palpate your bladder, and I wanna palpate for any fullness and then assess pain. So I will ask my patient if there was any pain. And then also I want to assess the vaginal area and the meatus. So I want to be able to know where it's at exactly. Okay, Ms. Smith, I'm going to go ahead and clean your vaginal area. I'm going to open up your labias. Is that okay? Okay, perfect. I want to ask for permission first. So what I want to do is I want to observe, and I want to make sure that I know exactly what I'm working with. I want to make sure that I check for any discharge, any odor, or any redness. I will start by washing out the vaginal area. So I will start with wipes and clean one area, throw away, another wipe, front to back, throw away. With my fingers, I will open up and clean the middle and throw away. I will go ahead and dispose of my gloves, perform hand hygiene. And now what I want to do is I want to open up my sterile field and kit. I will be working sterile. Therefore, I will start that process. While I'm doing this, I will just make conversation with my patient, ask her how her day was going. And yeah, I want to open up the sterile field away from me first. Okay, and then gonna get my gloves out. I want to grab my sheet, and this is sterile, so I want to make sure I just grab it from the corners. And what I want to do is I want to place it in the bed, because this is going to be my sterile field area, and I want to put the shiny part down. Now I'm going to grab my gloves, and I'm going to go ahead and open them up and put on a sterile field now. And while I'm doing this, I just want to talk to my patient, make sure that I help ease her nerves. And if she has any questions about the process, I can help answer those. Excuse me, my hands are a little sweaty, but I still have not broken sterile field. Okay, gloves are on. Okay. Now, usually what I would do is I will start by draping my patient, but because this is a mannequin, this slips out a lot. So what I would do is I will usually put it on top of my patient. I won't be using this just so I have space to work and it's not sliding and I'm not breaking sterile field. Now, both hands are sterile, so I'm going to be moving my supplies around. What I want to do first is I want to open up my iodine sticks. Make sure there's 3 of them because I will need 3. Put them in my box. I want to open up my loop, put a little bit of loop in my container here. Now, what I want to do is grab the syringe that I will be inflating the balloon with and hooking it up to my catheter. Okay, I dropped it. However, in reality, if it was dropped, I would definitely have to start the process all over again. Now, in this case, I'm going to assume I did not drop it, and I'm going to hook it up to my catheter. I'm going to keep everything intact in my box. Now, I'm gonna open up my catheter. I'm gonna lube up the tip. 1 to 2 inches I wanna lube up. I wanna leave it in my box. While maintaining sterility, I wanna move over my box into my bed. Like I said, if I had dropped my syringe in real life, I would definitely wanna start the process all over, and I would have to start with a new sterile box or kit. Okay, now what I will do now is I want to start by cleaning up my patient again, make sure that she is well cleaned. So my left hand will no longer be sterile. The minute I touch my patient, it will no longer be sterile, but I will be working with my right and that will be sterile. Okay, I'm going to explain to my patient, okay, Miss Smith, now we're going to start this process. Like I mentioned, it may be a little uncomfortable, but if it's severely painful, please let me know. I'm going to go ahead and start by touching your labia, opening it up. Now what I want to do is one of the iodine sticks, I want to clean the outer side, clean, trash. Second, clean, trash. And I do not want to move my left hand from there. And this is middle down, trash. What I want to do now is I'm going to grab the tip, and I want to grab it about 3 to 4 inches away from the tip, and I'm going to start the process of inserting. Now, Ms. Smith, I'm going to start the process of inserting now, so it's going to feel a little uncomfortable. Okay, here we go. Ready? 1, 2, 3. And I'm going to insert, and it's going to be about 3 to 4 inches or until I see urine. And now there's urine there. So what I want to do now that I saw urine back up, I want to inflate my balloon. I no longer have to be touching the labia or opening up the labia, I'm sorry. Okay, inflating the balloon. Perfect. Now what I want to do is I want to retract about 1 to 2 inches until I feel a little bit of force, but I do not want to pull it hard because I can be hurting my patient. I want to cut it some slack, And then what I'm gonna do is I'm going to clip the side, I'm gonna clip the tubing of the catheter over to my patient's leg. Make sure I give it enough slack so that my patient has mobility and is not going to interfere with her ADLs. What I'm gonna do now is I want to make sure that this bag, first of all, that it's closed, because otherwise I'm gonna have urine all over the place. And second of all, that it's being hung from the bed frame and it's below the patient's bladder. Now that I have that on there, I'm gonna assess it, make sure it's not pulling on anything, make sure that it's not, the tubing is not tugged or kinked. I'm gonna remove the syringe. And now I'm gonna cover up my patient after I've cleaned up her labia, because it may be a little gooey from what I was working with. I'm gonna remove my gloves after I have thrown away the trash. And if I remove my gloves by any chance, then I wanna just make sure I grab new gloves. Sorry, my hands are very sweaty now. But what I want to do essentially is they're on. I want to grab all of my trash, throw away, dispose of it where it needs to be, make sure my patient is fully covered, that I ask my patient if she is comfortable and if there's anything else I can do. I want to make sure that this trash has been picked up. I want to make sure that I lower the, sorry, I lower the bed, I can't find it. Okay, there we go. That I lower the bed to the lowest position and that I raise the rail back up, that my patient is in a comfortable position, that I go in the chart, document what I did, so what kind of catheter I did, and I also want to make sure that I measure the urine, I record the characteristic, and I record the color and clarity, and yeah, I am all done. Thank you.